Hello everyone, and today we're going to be talking about treating respiratory infections in mice. So the first thing we're going to cover is how do respiratory infections occur in mice. And two of the main reasons your mice may be getting respiratory infections is either ammonia buildup or perhaps introducing new mice that have already been infected themselves, and this is why it's very important to quarantine mice before you introduce them to existing mice. Ammonia buildup is usually caused by a lack of cleaning or not enough ventilation. Usually with mice, you're going to want to clean them at least once a week, maybe even a bit more than that if you have males or multiple females. In regards to lack of ventilation, this is usually only seen in aquariums, especially taller ones. The reason being is ammonia usually sinks to the bottom, and because the aquariums are glass on all sides, it contains the ammonia really well. Ammonia will irritate the mouse's respiratory system a lot, hence why it's so bad, and really important to keep up the hygiene and make sure your mouse's cage has enough ventilation. If you're not cleaning regularly, or if you are using an aquarium, this could be the reason why your mouse is showing symptoms. Your mice also may develop a respiratory infection if they're stressed. This is usually the case if they have an underlying health condition, especially if they've been infected with a virus, because their immune system's a lot weaker. So even something as simple as stress can cause them to get a respiratory infection, because of course they're not as strong and they're a lot more vulnerable. Being exposed to dusty or irritating materials can also cause respiratory infection in mice. When you're picking a bedding, you want to be careful that it's not too dusty, because mice have really sensitive respiratory systems. There are also numerous beddings that will irritate the respiratory system, one of them being pine. Usually, if it's not paper bedding or aspen, you shouldn't use it. Also, scented beddings are a big no-no, and this can cause problems with the respiratory tract, which will eventually lead to infection. Symptoms of respiratory infections involve sneezing and coughing, chattering of teeth, wheezing, hunched posture, discharge from eyes or nose, ruffled coats, and weight loss. There are multiple videos online. I'll have to attach some of what the chattering sounds like. It's got a very distinct sound. Mice usually don't make a lot of noise other than the occasional squeak when they're either stressed or playing. So if you do hear sounds from your mice, especially sneezing, that is not normal at all and a big sign of respiratory infection. I should also add that mice are very good at hiding that they're sick. You may not notice they're sick until the infection's pretty far developed. Hence why when you notice this, it is so important to treat as quickly as possible. Respiratory infections are usually caused by Mycoplasma bacteria. Mycoplasma is actually found naturally in most mice. However, when the respiratory tract is irritated, it will cause the Mycoplasma to flare and cause an infection. Unlike Mycoplasma, Sendai virus is untreatable. It causes some similar effects to Mycoplasma, however isn't as severe, although the Sendai virus can cause a lot of complications when combined with Mycoplasma infections. Sendai virus can also put the mouse more at risk from infections than if it didn't have the Sendai virus. This is because it weakens the immune system. When administer antibiotics, there's normally 3 ways. One's oral, one's through injection, and the other one's through aerosol. For this video, I'll be discussing about how to administrate it orally. Of course, you can inject the mouse as well, although I wouldn't recommend this unless you are a vet or are familiar with injecting mice. I also watched a very interesting video on about someone using an aerosol to administer the antibiotics. I'll add the video into the description. I don't know much about it at all, but it appears to have worked for them. So I thought I'd add it to the list because it's something I've never really seen before and I found it very interesting. There are three main ways you can administer antibiotics orally. The easiest I found was mixing it with food, because usually they'll eat it all themselves, and if you're unfamiliar with scruffing them and giving it by syringe, it's a lot less stressful for the mouse. If you can scruff them and give it to them through a syringe, props to you. I found that really difficult. There are numerous videos online on how to administer antibiotics through a syringe, so I won't go into too much detail. I'll just let you guys look at the video. But the final way you can do it is also through a water bottle. I wouldn't recommend doing this though, because different mice will drink different amounts of water, and of course then you don't know how much of the antibiotic they're getting. It will still work in most cases, however usually you want to give them an exact amount. Luckily for you guys, when my mouse was sick, I got to experiment with lots and lots of different foods, so I can tell you which one I found best. For me personally, I found the mice liked porridge the most. What you do is you mix a little bit of porridge with some water, and I found bottle caps are good, especially smaller bottle caps, because then you're not getting all the porridge stuck around the sides and they can get every single little bit in the smaller ones. You're going to want to inject the antibiotics into the porridge, and then they'll just eat all the porridge, and you can take the bowl out when they're done. If you're going to administer it directly with a syringe into their mouth, but you don't want to scruff them, another way you can do it is by putting a piece of honey on the end of the syringe. I found my mice would come over to the syringe, start licking off the honey, and while they're licking off the honey, you can slowly inject the antibiotic into their mouth, and they'll lick off all the honey and antibiotics, and it's pretty easy to do. Baby food and mashed banana also works really well. You do this in the same way you would the porridge, put it in a small bottle cap, put in the antibiotics, and mix it. Make sure you mix it. One of the drugs I'll be listing in this video interacts with dairy, so I would not recommend using any dairy products to mix the antibiotics with. That means no yogurt or anything like that. Now onto the drugs themselves. For treating respiratory infections caused by a bacteria, you're going to want to use Enrofloxacin. The brand names for these are usually going to be Baytril or Enroquin, those are the most common. You're going to want to use this at a dosage of 5 to 20 milligrams per kilogram. Of course, this is the dosage for the oral one. You'll want to dose for 5 milligrams if the respiratory infection is less severe, and for more severe cases you can use up to 20 milligrams. You're not going to want to use more than this, and you're going to want to use it for a duration of 3 to 4 weeks. Enrofloxacin comes in many different forms. You can get it as a liquid, a tablet, or a powder. I'd personally recommend a liquid or the tablet, because as a powder it's a lot more difficult to measure out how much you need. In regards to purchasing antibiotics, you can buy antibiotics online without a vet. I'll stick some websites in the description so you guys can go there, but usually it's pigeon websites or bird websites. The antibiotics you'll be receiving are aimed towards birds, but they will work for anything really: reptiles, rodents, poultry, you name it, it's the same antibiotic, it will work. The only downside to getting it online is it's a lot more expensive online than through a vet, but then again with a vet you'll have to pay for the consultation fees and things like that. It also obviously takes a bit of time to get it shipped out, and you may not have that time, which is why it's always best to go to a vet. But if your vets aren't very good in your area, or if you don't have the money to pay for a vet, this is a good alternative. The next drug you'll want to use in combination with Enrofloxacin. It makes the treatment a lot more effective. You don't have to use it, but I'd highly recommend it. It's doxycycline. You're going to want to use this at a dosage of 5 milligrams per kilogram. I believe I have seen it dosed as high as 10 milligrams per kilogram, but don't quote me on that. I'd stick to the 5 milligrams. 5 milligrams is more than sufficient. I've also seen it as low as 2.5 milligrams per kilogram, but 5 milligrams seems to be the average. You're going to want to do this for a time frame of 3 to 4 weeks alongside the Enrofloxacin, and similarly It also comes as liquid tablet or powder. Just for a heads up, there's also two types of doxycycline. There's hyclate and monohydrates. The only difference is how they dissolve in water. The effectiveness of the doxycycline doesn't vary from different types. It's the same drug. Now here is the interesting part. On the screen here you have how to calculate the doses. It is a bit of a mess, I apologise about that, but there is a lot of information and I try to compact it as well as possible and have it as easy to follow as possible. Hopefully I did a good job, but if you can't understand a single word of what's on this screen, it's okay, no need to fear. I have some calculators down in the description. You're going to want to use both of them to figure out all the different things. I'd read this first just so you can get a rough idea of what the process is and then use the calculators, help you get a bit of understanding behind it all. But with the calculator you'll be able to figure out the doses and stuff like that. It's pretty straightforward. If you're still struggling, feel free to drop a comment. I'd be more than happy to solve out all the dosages for you. You can also go onto Facebook. There's a lot of mouse forums on there and even some vet ones. If you just throw your dosages on there and be like, "Oi, can someone help me figure out what dose I need?" They'll be more than happy to help you. There are a lot more details I could go into regarding every single little aspect from this, but this is just a beginner's guide. I don't know much more information than what I'm giving you. I just know when I went to go look all of this up, I found it really difficult to navigate through all of the information. So I thought now that I've gone through the process with my mouse having a respiratory infection, I try to cram all the information together in one place on YouTube because I haven't seen a YouTube video going into that much depth regarding treating respiratory infections in mice. So I thought I'd just go through the basics. Hopefully you guys have a better understanding of what to do. I'm not a vet or anything, I'm just a normal person, so like everything on the internet, take what I said with a grain of salt, do your own research, but this should be a good starting point for you all. Hope you have an excellent day. Thank you very much for watching this. Bye bye.